In our daily lives, we may encounter emergency situations that require first aid. These skills can mean the difference between life and death. Nurses, in particular, play a crucial role in handling such cases because they have been trained to act quickly and efficiently in critical situations. Today, we will discuss the basic principles of first aid, focusing on CPR, fractures, and burns. The very first step in providing first aid is ensuring the scene is safe. Before doing anything else, it's essential to make sure that the environment is secure for both ourselves and the injured person. This means checking for any potential hazards, such as traffic, fire, or other dangers that could pose a risk during the rescue. Only when we are confident that it's safe do we proceed to assess the victim's condition. This involves looking for any visible injuries, checking responsiveness, and determining whether immediate help is needed. If we find that the victim is in need of urgent assistance, the next step is to call for emergency assistance or notify medical professionals without delay. Time is often critical in emergency situations, and quick action can save lives. Now, let's talk about CPR, which is one of the most essential first aid skills. If we encounter an unconscious person who is not breathing, it is crucial to start CPR immediately. First, we need to check the person's responsiveness and breathing. If they are unresponsive and not breathing at all, we begin chest compressions right away. To perform CPR, we place our hands in the center of the person's chest, interlock our fingers, and press down hard and fast at a rate of 100 to 120 compressions per minute. This rhythm is essential to maintain adequate blood flow. If you are trained in rescue breathing, after every 30 compressions, you can provide 2 rescue breaths. Remember, we must continue this cycle of compressions and breaths until professional medical help arrives or the person shows signs of life. Moving on to fractures, it is important to understand that these injuries can be serious, and we must handle them with care. The first step is to quickly assess the injured person. If there is a suspicion of a fracture, we need to stop any movement in the affected area to prevent further injury. Next, we aim to immobilize the fracture using any available materials. This could include splints or even a piece of cloth to keep the area stable. Additionally, applying ice to the area can help reduce swelling, but we must be careful not to apply ice directly to the skin. Burns are another common emergency that varies in severity and requires different approaches. For first-degree burns, the best course of action is to cool the area with running cold water for at least 10 to 20 minutes, but avoid using ice since it can further damage the skin. When dealing with second or third-degree burns, we should cover the affected area with a sterile, non-stick dressing. It's critical to avoid removing any clothing that may be stuck to the burn. Never apply lotions, creams, or oils directly onto burns, as they can complicate the injury and interfere with healing. In all these cases, whether it's a fracture, a burn, or administering CPR, we must ensure that professional medical help is sought as soon as possible. If the burn is severe, the fracture is major, or the person's condition is life-threatening, we should not hesitate to call emergency services immediately. In conclusion, first aid is a vital life skill that everyone should be familiar with, especially nurses and caregivers. Regular training and practice are essential for delivering fast and effective emergency care when it's most needed. By understanding these basic principles of first aid, you can be better prepared to handle emergencies and potentially save a life.